Hello, I'm Barry Shore, Professor Emeritus at the University of New Hampshire and Head of Content Development here at SSGI. Healthcare is certainly one of the more important and challenging issues of our time. While there has been considerable progress in delivering better patient value, there still remains much that can be done. This guide, written for all professionals, from medical staff to administrators, focuses on how we can proactively address these challenges, how they can be part of the momentum toward more efficient use of scarce resources, and how they can accomplish this while improving healthcare quality. It addresses these challenges by identifying 11 critical areas associated with achieving an efficient or lean healthcare environment. Any effort at improving healthcare process efficiency needs to be organized. The literature on lean has provided us with a proven framework that can guide us through this improvement process. That framework is called DMAIC. The D represents the first step, define. It focuses on uncovering and documenting the root source of the problem, not its symptoms. The second step, M, is to measure the problem by collecting data so that we have a precise and accurate description of what currently exists and establish a realistic target for what can be accomplished. The third step, A, focuses on analyzing the data to better understand the problem, further reveal its root cause, and point to a solution. In the fourth step, I, the process is improved. The final step, C, is to develop control systems so that the new or revised system can be monitored over time to ensure that results continue to conform to expectations. Lean professionals often begin a process improvement project by identifying all relevant suppliers, inputs, processes, outputs, and customers. They are summarized in a SIPOC diagram, an acronym for suppliers, inputs, process, outputs, and customers. Here is an example of a SIPOC diagram for a hospital pharmacy. It helps to think of healthcare operations as a system. When we look at them in this way, we are more likely to focus on the whole rather than its parts. And a systems view also helps to emphasize the interconnectedness of every part of that whole and how they combine to deliver patient outcomes. So rather than focusing only on the efficiencies of processing blood tests for a patient presenting with signs of a coronary event, a systems approach would focus on the entire process from the time the ambulance arrives at the patient's location to treatment and even recovery. So interconnectedness is an important concept in lean and especially lean healthcare. Flowcharts also help us with the systems view. They provide a visual overview, simple but effective. Here is a flowchart that summarizes patient flow from arrival to discharge in the emergency department. In these flowcharts, each step is drawn as a rectangle with arrows indicating the direction of flow. Often, they are referred to as value stream maps. From this flowchart, we can see that patients arrive at the ED, register, triage places the patient in the proper healthcare category, the patient is assigned to a room, a nurse examines the patient, lab work is ordered, the physician examines the patient, a diagnosis is reached, and if appropriate, the patient is discharged or admitted. Flowcharts are indispensable for many reasons. In addition to visually describing a process, they help us to isolate where process delays, errors, and waste occur, and even indicate how these problems affect the remaining steps in the process. Waste is not uncommon in healthcare. When it does exist, it needs to be addressed and, if possible, eliminated. Once again, the tradition of lean provides some insight into where we might typically find operational waste. There are 8 such areas. The first is transportation or logistics. For example, moving patients from one area to another adds little patient value, so efficient patient flow needs to be one of the considerations when planning facilities layout. The second is inventory. When there is either too much or too little inventory, such as medical supplies, carrying costs or shortage costs increase and contribute to a waste of economic resources. The challenge is to avoid this waste by carrying just the right amount of inventory. The third is unnecessary motion. For example, it has been suggested that nurses spend as much as 30 to 40% of their time on supply-related issues, much of which involve motion. Waiting represents a major waste. Holding a patient in the ED because an inpatient bed is not available is but one example. Overprocessing, another waste, occurs when too much time is spent with a patient or more information is collected from the patient than is necessary. It can also occur when administrative processes are overly complex. Overproduction or overtreatment is another source where marginal tests are ordered that add little value to a diagnosis or to their recovery. Process defects in healthcare include medical or equipment failures. For example, a medical failure could be an early discharge followed by readmission or the failure to comply with a checklist when inserting a PICC line. Fraud also suggests a defect in the system. Finally, human resources are often underutilized and thereby represent another source of waste. It can occur, for example, when staff is not provided with the opportunity to achieve their full potential. Process delays have many consequences. Certainly, the most dramatic occur during medical emergencies such as heart attacks, strokes, pneumonia, and sepsis shock, where delays can have a significant impact on survival. But there are many other opportunities to address delays by reducing redundancies, eliminating unnecessary steps, and integrating activities across medical departments. The Institute of Medicine has estimated that 100,000 people lose their lives every year from medical errors in the United States. Yet other studies, including one published in BMJ, formerly the British Medical Journal, concluded that this estimate is too low and that the number of deaths is closer to 250,000. Clearly, preventing these errors through better processes, as well as the use of new technologies, is a major challenge. It helps to know in which areas those errors are likely to occur. One such list would include the emergency department, inpatient units, laboratories, operating rooms, the pharmacy, and imaging. We can also categorize errors by frequency of occurrence. The top several include adverse drug events, catheter-associated urinary tract infections, central line-associated bloodstream infections, and injuries from falls. Prevention is critically important. In fact, checklists used before medical procedures begin have proven to be very effective at reducing some major errors. Rather than waiting for a problem to occur and then assigning a team to address it, another approach, also borrowed from the literature on lean, is to convene a group of stakeholders who then explore the process for probable weak points and determine how these potential trouble spots can be mitigated or eliminated altogether. It is an approach called failure mode and effects analysis, or FMEA. Pokayoke is a Japanese term that can be translated as mistake proofing. In lean healthcare, its objective is to employ the use of systems, software, procedures, or devices to reduce or eliminate the possibility that a human error could occur. One example of Pokayoke is the use of marking pens by surgeons to identify and sign a surgical site before surgery begins. This process has been credited with nearly eliminating wrong side and wrong site surgeries. Once the effort to improve process performance has been made, one very important step still remains. It is important because there is never any guarantee that improvements will last. In fact, in most situations, they will not. That step is the last one in DMAIC, called control. To control process performance, it is necessary to begin by monitoring the process output, usually by taking a sample and calculating its mean or average. It might be the average number of hospital-acquired infections in 1 month, the average wait time in the emergency department, or the average number of no-shows in a neurological clinic. The results are plotted on a control chart. Here is a chart for monitoring patient satisfaction. A sample of 35 patients is taken monthly, and the mean of that sample is plotted on the chart. As long as the sample means remain within expected boundaries, called an upper and lower control limit, the process is considered to be in control. When the mean extends beyond these boundaries, the system is considered to be out of control and remedial action taken. Process performance can always be improved. Not only can experience and feedback suggest better ways of delivering healthcare, but advancements in medical technology, information technology, medical procedures, administrative procedures, and pharmaceuticals also motivate change. As a result, continuous improvement becomes an integral part of the process management function. In fact, many healthcare organizations emphasize the importance of this challenge by appointing a continuous improvement officer. If you have found the material in this guide interesting and helpful, you might consider becoming professionally qualified as a certified lean healthcare professional, CHLP. You probably have 2 questions in mind. How difficult will it be, and how long will it take? The answer to the first question depends upon where you begin. Once you have completed this guide, you are already well on your way, and the full course is no more difficult than the material covered here. How long will it take? The full course, including the certification exam, should take no more than 1 month, as long as you are willing to put in a few hours each evening. To accommodate your busy schedule, both the course and certification exam are online and can be accessed at your convenience. Six Sigma Global Institute also offers a range of process control and leadership courses, including a Healthcare Lean Six Sigma course and a Healthcare Project Management course. Click below for more details.